This is LiveWell Talk on St. Luke's Marion Emergency Room Trauma Designation. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. UnityPoint Health, St. Luke's Hospital, Marion ER has just become the first and only freestanding emergency room in Iowa to receive a Level 4 Trauma Center designation. That's a big deal, not just for the hospital, but for every patient and family who may need services. Joining us today is Craig Liscum, trauma coordinator at St. Luke's, to talk about what this designation means, the work it took to get there, and how it's changing the landscape of trauma in our region. Craig, welcome to the show.
Thank you.
Congratulations.
Thanks.
Take us through first, what's Category 1, what's Category 2, what's Category 3, what's Category 4?
Sure. So it basically, each category, it's based on what services you can provide as a facility. You know, level 1, level 2, they have everything, including neurosurgery. They have education and research and things of that nature. You get down to level 3, which is what St. Luke's Cedar Rapids is designated. We have all the capabilities except for neurosurgery. And then level 4 is we don't have general surgery, so we're able to stabilize and get them out to where they need to be. So that's in a nutshell. So,
well, take us through what did you have to do, the process to
Sure.
get the Marion ER.
Yeah, so I'll start off with square one, and with when I found out that St. Luke's was going to build or going to open a standalone ER. It was like the next day or within the week, I talked to Sandy, our ER director, and go, hey, I think this needs to be done. And she was like, go forth. I called the state and I go, hey, this is what and I had a relationship with the state, people at state already, and go, hey, this is what's happening and this is what I want to do. Not like, can I do it? But we are going to do it. How do we do it? So, and that's what the collaboration started. And it was just collecting, making sure we had all the processes and procedures in place that showed that we had those processes and policies in place to provide that care. Everything from what training we have to have. We have to have the physicians and providers have to have ATLS, Advanced Trauma Life Support. The nurses and medics out there, they have to have trauma or TNCC, which is Trauma Nurse Core course for the nurses. So we had to have, just making sure that we had everything in line to provide that care. So.
And that's, I think, talk a little bit about why that's important, because I think even some people in healthcare don't understand that when you have these certifications, it keeps you updated and evidence-based, because you can really drift off the standard of care if you're not measuring your standard against what's new.
Yeah. So, I can answer the question why, first, why did we want to do this? Because, it was the right thing to do. Second of all, provide or having a verification gives, let's say, the consumer evidence that we're up to standards. Okay. We look at Yelp reviews, we're always looking for those 5 stars. When we go out, if I see a place that has Iowa's best tenderloin, I'm going to try that. So we're always looking as consumers for that. And we were already providing great trauma care. I mean, there was no doubt in that, but it shows the patients that are coming to our facility that we have met these standards to do so.
Yeah. I find it of value. It just keeps you up to date,
100%,
current with changes. I mean, ACLS is about every 5 years it changes, and if you're not paying attention or recertifying, you might miss out on some of that.
Right. And part of, we have to have, we do what's called process improvement. It's one of those words that's out there, and it's always what we're looking at. We look at every case that comes through. Every trauma case that comes through is looked at. Are we providing great care? Is there any care concerns? Are we documenting appropriately? Things of that nature. And if there's anything that needs to be changed, we're always looking if we need to change a process, if we need to improve. We're always and looking at the evidence base, looking at what are the standards out there to show that that we're on top of things. Yeah, we're always going through a process. It's always a continuance. It's never a stagnant thing. Okay, go and put a bandage on it. Okay,
right.
No, there's other stuff back involved that's always changing.
You take us through. I think freestanding emergency room. Mm-hmm. The first thing, healthcare insiders maybe, and maybe some lay people, some listeners, it's like, oh my God, how are they going to handle these emergencies?
Right.
So take us, what degree of care is provided out there? And is there a process like where the ambulance says, well, I'm going to drive by and go to, just how's that work?
Definitely. So let's go back to EMS. And if we go back, trauma care starts at somebody recognizing the injury. That could be a layperson. That could be, someone who has a good Samaritan out there. They've taken the Stop the Bleed course, or, my son's in Boy Scouts now, and they have first aid merit badge. Whatever that basic training is, providing aid, and then it's activating 911, and that's what activates that emergency services. So, our EMS services in the area that primarily transport to us have gone through education and stuff, and there's a thing called the pre-hospital, out-of-hospital trauma triage protocol, and it says that the patient is supposed to go to the closest appropriate facility. Now, Marion ER doesn't have, we don't have an operating room out there. We don't have surgical capabilities out there. So if there's anything indicating that they're going to have maybe get some sort of surgical intervention, the appropriate facility is definitely down here in Cedar Rapids at St. Luke's downtown. So,
I know you know this, but I review every transfer that leaves St. Luke's and goes to wherever, mm-hmm. right? And get the list each morning, go through the list, look at it, say, did we have a process improvement that we can possibly execute upon? I don't see a lot of stuff. It's almost like people are self-selecting as well. They know, okay, I've got this stab wound. I'm going to go downtown. I'm not going to stop in the Marion ER. Right. Do you think, is that the experience of the team out there?
I think there's some, I think, EMS does very well out there. And I know from on a medical standpoint, if I have, those with significant cardiac issues or stroke symptoms, I've heard that they're going down because they know that. But
although, to be clear, we have it set up in place that we can start that critical care pathway out there.
You bet. EMS has their training, but this absolutely does not stop, the drop-offs, the people that arrive by private vehicle, the walk-ins. And we've had those significant traumas walk in through that front door, and we have to start that process of getting them immediately back, starting to getting them assessed, identifying what their injuries are, intervening on severe hemorrhage, making sure all the holes are stopped so their blood doesn't come out. If we have to get airways in them, addressing all of those life-threatening concerns, and then if we have to, getting their vital signs, knowing what they are, getting the labs done. If we have to, we could get emergency blood products out there. But all while this is happening back there, there's staff that is working on that patient needs to get transferred. They're on the phone with general surgery or whomever down here at Cedar Rapids. If it's, say, a head injury, we know that that's going to go to the university or to a place with neurosurgery. So they're working on the process to get them out because, time is what it's at. and we need to get them fixed in time.
Right.
So,
what I should have asked to begin with, okay, you got the certification, the designation. When do you renew that?
So the renewal is every 3 years. So
3
it's
years.
a 3-year cycle. So our next renewal will be in 5, 6, 7. We'll actually renew in 2028 for a 3-year cycle. So we'll have to go through it all again.
And is 3 years the same for downtown ER?
Yeah, actually, it's going to the same years are going to mimic. We're up for re-verification in August for Cedar Rapids, and so the state, we're going to somehow they're going to be the same year, and might be they're going to stay here for 2 days and do one day and the other.
Is it, we keep saying the state, is it Health and Human Services that still regulates this?
Yeah, it's Health and Human Services Department of Emergency and Bureau of Emergency and Trauma Services.
Okay,
vets.
yeah.
So,
but it's still HHS
yes.
that oversees this big umbrella. Actually, I don't know why your name came up at home, and I said something to Tanya, my wife. I said, yeah, well, he was IT out at Jones at one point.
Yeah, so
and she's like, no, he wasn't. I'm going, no, he was.
Yeah, so I've had
so let's take us through your career.
My career, okay, so I started my medical career started in 1995. I took my first EMT course right out of high school in 1995 and went through the paramedic course. I actually got hired here at St. Luke's in 97 as a security officer. After I got my paramedic, I went and worked. And then I worked as a paramedic while I was going to nursing school. I worked out at Anamosa, and it was Anamosa Community Hospital, Anamosa.
The old
ambulance.
hospital.
Oh, yeah. So I worked there during nursing school. After I graduated nursing school, I went, worked ICU here, and I went on and I went some places just kind of finding my niche. And I worked business for 6 years at a church. So, and then I decided I needed to get back into medicine. I missed it. I missed emergency medicine and stuff like that. So I went back out to Jones Regional and worked on the ambulance out there. And there was an opportunity to work in informatics out there.
Yeah,
also. So that's where I was. And then came down here to St. Luke's got hired with Lifeguard, and then progressed into where I am now. So.
Yeah. We were talking about Jones, and I said, well, yeah, and I mentioned your name that you worked out there in IT. She's like, no, he didn't. No, he's never worked out there in IT. I was like,
yeah.
Well, yeah, you have.
Yes, Tanya, I did.
Yeah,
yes.
Yeah. So we have proof. Craig, thank you so much for joining us today and sharing the story behind this designation and letting our listeners know why it's so important. The Level 4 Trauma Center designation at St. Luke's Marion ER really demonstrates the dedication, expertise, and preparedness of the team. If you want to learn more about the services offered at St. Luke's Marion ER, you can visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.